Hello, everyone. My name is Bianca Bautista, and I am a SNAP educator at the University of Illinois Extension. This is a part of our Nourishing Mind series, and this week we are learning about donation gardens and wellness body mapping. For those of you who don't know about University of Illinois Extension, we have 27 offices across the state. That's one office per county. And we do everything from STEM to Master Gardeners programs. Before we get into learning outcomes, how many of you know what a donation garden is? That's an important part of this presentation. A donation garden is a garden made with the intention that some or all of the food grown will be donated to those in need of the produce. We'll talk about how that process works later. So today, our learning outcomes are as shown. These learning outcomes will give you a basic understanding of the work ahead of you. Today, we'll define nutrition security, establish the purpose of your garden, and explore sources of funding for your garden project. So let's start by defining nutrition security. The official definition of nutrition security is consistent access, availability, and affordability of culturally relevant foods and beverages that promote well-being, prevent disease, and if needed, treat disease. Wow, that's a lot of words. I'm going to give you a moment to let that sink in. Then, if you'd like, please type into the chat or pop off mic what those highlighted words mean to you, specifically consistent, availability, affordability, and culturally relevant. What kind of foods come to mind? What other words do they make you think of? Are these words meaningful?
This really makes me think of Cicero and how a lot of suburban Cook County neighborhoods have an oversaturation of fast food restaurants or liquor stores, but an undersaturation of grocery stores.
Yes, thank you for bringing that up. Cicero and a couple of other neighborhoods in the suburbs have an oversaturation of fast food restaurants. We call these food swamps, which is the opposite of food deserts, but we also try and stay away from terms that involve the ecosystem because we want to make sure that our audiences understand that these things don't naturally happen out in communities. These are issues that stem from systemic, um, like racism, inequities that have been founded for years. This diagram represents the differences between households with different levels of nutrition security. The main point I'd like you to grasp from this diagram is that households with very low nutrition security not only experience hunger, but also face issues of chronic illness, low test scores for their kids, and they may have to choose between purchasing life-saving medication and buying food. The environment people live in may lack grocery stores and food pantries. We call these food apartheids. Food apartheids, formerly known as food deserts, occur due to systemic issues in an existing area, whereas food deserts imply that these food-barren lands are naturally occurring. But just think about what's going on here, even at this second level from the top. At this second level from the top, some are still experiencing anxiety in their household due to issues with food access. Now, I want us to think back to that moment where we were all cooped up inside and the world was a very scary apocalyptic place for 2 weeks. Did anyone here experience a food shortage in their area? List the foods you were experiencing a shortage of and how that made you feel.
I experienced and can still experience a shortage of milk. I'm lactose intolerant. I'm Hispanic, and it's pretty common in my ethnicity, I suppose. And it was awful. I mean, I couldn't have cereal. I couldn't have some of the things that staple things that I like to consume because there was just no milk or the milk that I needed.
Yes, milk is a very important household staple. I would say here in the Midwest, especially, we use it as a source of protein for our kids to grow. We use it in recipes very often. Milk is a great replacement for a lot of proteins that people can't eat as well. As you were sharing, lactose intolerance does happen a lot. and commonly in this area as well. That shortage may have not been limited to just regular milk. It could have been lactose-free milk as well, which is very scary for those who need lactose-free milk for their daily eating habits. I'm going to read some statistics that may shock you. There are three of these statistics slides. At the end of these slides, we'll do an emotional check-in to see what kind of feelings these statistics brought up. 1 in 10 individuals in Illinois are nutrition insecure. 1 in 6 children in Illinois are nutrition insecure. 1 in 3 nutrition insecure families in Illinois do not qualify for federal nutrition programs. Kids who go to school without having any food to nourish their brains have a harder time concentrating in class and can feel very tired. They do not eat enough food to function on a daily basis. In 2018, the nutrition insecurity rate for Cook County was 10.1%. In 2022, that number raised to 16% of households. 22% of households within Cook County are experiencing nutrition insecurity as of 2023. And remember, as of February 2023, the extra SNAP COVID benefits came to an end. And I apologize, I said it was 3 slides, but it is only 2. How do these statistics make you feel? Are there any statistics that are particularly surprising?
Yeah, it's really sad to think that I could be in a group of 10 people and one of them could be starving and I wouldn't even know.
Yes, it is extremely unsettling to think that we could miss the faces and signs of hunger so easily. Um, Part of what we can do to solve that is when we do nutrition security screenings at hospitals. They usually have like an anonymous survey after you do your checkup, and they ask you, um, do you face any poverty levels? Is there enough food at home? Very discreet, great way of making sure that we can provide for Illinois residents. So, how can we give back to these individuals facing nutrition insecurity using a donation garden? And who can help us? Well, let's start with the farmers and local gardens. These growers may have more produce on their hands than they can handle. They can donate this excess produce to a food pantry. Food pantries can also create partnerships with local growers, gardeners, farmers, and garden clubs, and community gardens and school gardens too. They'll provide their shoppers with fresh produce through these methods. Then there are the volunteers. Volunteers help pack the extra produce or coordinate their efforts to pick up produce. Volunteers donate their time and effort and provide a pleasant experience for pantry goers. University of Illinois Extension also has our SNAP Healthy Marketing Program, where organizations promoting these feeding efforts can find recipes to bundle along with produce, money-saving tips, and physical activity ideas. We'll explore this later. Finally, we have SNAP educators and community workers. As an educator, it is my job to provide staff and volunteers for professional development. We also focus on changing policies, systems, and environment to promote nutrition and health. Community workers provide curriculum-based support for pantry goers. They hold classes virtually and in person for SNAP participants. Their curriculum involves the Eat, Move, Save lesson plans developed by the extension. As you can see, with just a little effort on everyone's part, we can make a difference. Steps to planting a donation garden. There are 4 easy steps you can use to plan a donation garden. The first is identify a need. Work with local organizations to determine if there is a need for a garden. Step 2, plan and coordinate. Work with decision makers or wellness committees to determine plans for the garden. Ask yourself, who will maintain the garden? How can we get students involved? Where can this produce be used? In a school, for example, a curriculum can be used to educate and support the purpose of a school donation garden. Number 3, determine where to donate. Work with local food banks to identify potential partners who can use the garden donations. Work with the community to help find other pantries not utilizing the food bank or other organizations addressing food insecurity, such as food pantries, food banks, meal programs, soup kitchens, senior centers, school daycares, and after school centers, faith based organizations, drop off sites collecting food for delivery to pantries, and more. Number 4, identify produce to grow. Some townships or garden clubs have what's called a seed library. Gardeners can take a few seeds and at the end of the season bring seeds back, free of charge typically. Sometimes garden events will have free plants available as well, or you can work with an Extension Master Gardener program to obtain plants. Consider which produce to grow based on culturally familiar foods, nutrition, and time of season. Funding ideas. Now, the word funding may sound overwhelming to you, but there are a variety of ways you can obtain funding. It won't always be a pain if you plan ahead. There are 4 types of funding you can consider: crowdfunding, sponsors, local organizations, and grants. So, what is crowdfunding? Crowdfunding involves reaching out to a crowd of individuals who can collectively provide you with donations to fund your venture. That's pretty straightforward. You can make an account on any of these platforms and link them to social media for marketing purposes. The more views you get on a social media account, the more likely you are to get funding. Sponsors. You can ask local sponsors such as a tool company, a chain restaurant, or a warehouse to fund your garden. They may ask you to equip your garden with a sign containing their logo, but it's always important to give credit where credit is due. And that local support may help your garden grow. Other sponsors may reach out to you, which will keep the garden fund sustainable. Local organizations. Organizations like these, Star Farm Chicago and Chicago Food Sovereignty Coalition, usually have interest in community initiatives. To find organizations like these, please reach out to a SNAP educator or a technical assistance provider, or check out places like the Chicago Food Policy Action Council, the Chicago Food Justice Summit, or simply type in your Google search bar, Hunger Coalitions in my area. I guarantee you will find at least one organization. There are several grants available to choose from. The application process is pretty easy even if you're a first-time grant writer, but keep in mind that each of these grants all have different due dates and specific application guidelines. I'll leave this slide up for a little bit if you'd like some time to pull up the grants on your own. Gathering volunteers. So you have your garden now. What can you do with it? How do you get volunteers to come help? Work with coalitions or create a gardening group in your area. You can also ask a community relations team at a local hospital if they have room for a food as medicine garden, where the hospital sponsors the garden and volunteers maintain the program. Churches also have the ability to utilize their space for a donation garden program. Get students involved. You can start a garden at a school as a part of a curriculum or an after-school program. Consider reaching out to a local representative of your township or district. They love to sponsor sustainable projects that can get their foot in the door. Go to parent-teacher conferences and ask if any of the parents would be willing to stick around for a 5 or 10-minute garden talk. Have pictures handy for this. Volunteers flock to projects where they can visibly see the project is making a difference, and that's best shown in photos. Does your community have a nutrition or wellness committee? If not, you can create one. You'll also find more than enough volunteers at a school wellness committee where the board is committed to the health of their students. This is our Eat Move Save website. Eat Move Save is the Illinois SNAP marketing initiative where SNAP participants can save money using research-based tips and tricks. There are recipes in multiple languages using common produce found at food pantries with nutrition information. This information can help you decide which fruits and vegetables to plant in your garden by selecting common varieties. Additionally, you can support your garden with signage that encourages physical activity and put your garden on our Fine Food Illinois map. Moving on to wellness body mapping. This portion looks a little different when we're in person because we're mapping out the effects of the physical environment on our health. Since we're not in person, I'll be giving you tools that will put this body mapping into perspective. The learning outcomes for this half of the presentation will be conducting observational assessments, which sounds scarier than it actually is, understanding how nutrition is impacted by our surroundings, and everyone's favorite, discussing how we can improve overall health outcomes in our communities. Let's start with a quick activity. Visualize yourself somewhere familiar in your community. Reflect on details such as, is there access to public water? Is there a restaurant, store, or food pantries close by? Are there handicap accessible streets? Is there a hospital or medical clinic nearby? I'll give you a few moments to think. Now let's answer these questions together. Did you think about somewhere urban or suburban?
Thought about somewhere urban like Chicago.
How different
Um,
would this activity be if you thought about somewhere rural?
this would be so different if I thought about somewhere like Wisconsin or Southern Illinois. The built environment is so different.
Were there any resources you felt were lacking or missing? What were they?
In Chicago, we have a lot of biking lanes, but not a lot of safe streets.
Was there a resource you felt your community had an abundance of?
Well, there are so many wonderful organizations in the area that are willing to help an individual or a family.
How do you think this information can be used in the future?
Well, I think knowing that we have so many organizations that are involved in aspects like safety, maybe they could work at the coalition level to promote changing the physical environment for safe biking routes.
Thank you for sharing. Walking needs assessments. Needs assessments don't have to be formalized on paper, and they don't always require quantitative data. You can gather plenty of data with your eyes too. Some of you may have done informal needs assessments, like this walking needs assessment as a student. Maybe your teacher asked you to count the number of red cars you see in an hour, or count the number of colored M&Ms. What's great about this walking needs assessment is that the data can be taken from participants of all ages, unless stated otherwise. This is because there is no direct interaction with study subjects, but make sure your participants are of an age that they can read. During a walking needs assessment, you'll write down observations such as any safety issues you may see or number of lampposts to provide qualitative and quantitative data. At the end of the walking needs assessment, you'll record your findings and have a discussion amongst participants regarding opportunities for improvement, resources in your communities, and any inequities you found. Next activity. Visualize yourself in a kitchen, at a restaurant, or wherever you eat food. Where does the food come from? Is this food healing or nutritious? What regulations are in place that make your food safe to eat? I'll give you another moment to think, then we'll answer some more questions. Let's answer some of these discussion questions. What kind of food were you thinking about?
I was thinking about my salad from lunch.
What is the path your salad traveled from? Do you think this is costly in terms of price, health, or environment?
The lettuce is probably harvested from elsewhere in the world, probably South America. It was expensive compared to other lettuce or even buying a whole sandwich, but it is worth my health since I made the salad. There's not a lot of waste that will make me feel guilty because I'm making it.
Could you make this food if you shopped at a food pantry? Can you make this food from scratch?
I hope people who shop at food pantries have access to lettuce. It's very easy to make a salad with.
Do you have any worries about this food being safe to eat?
I never thought about if lettuce was safe to eat, but because it grows in the ground, that does worry me. What else could be in the soil? What kind of inspections do, lettuce go through?
Are there any barriers preventing this food from benefiting your health?
The only barrier is cost. If it was cheaper for me to make me myself a salad every day, I would. It also takes time to make a salad or prepackage it.
Thank you for sharing. The socio-ecological model is a framework for understanding how various levels of influences, such as in the individual, interpersonal, organizational, community, and public policy levels, interact to affect behaviors and health outcomes. The easiest way to think about this model is in terms of resources. So, at the individual level, someone may not have access to a kitchen in their house. At the relationships level, they may reach out to a family member to use their kitchen. Maybe one day they can't access the family's kitchen, so this individual may reach out to a local organization for access to cooking arrangements. If the organization can't provide the individual with cooking appliances, they may refer to the township to initiate a community kitchen project. Now we're going over the fundamentals of policy systems and environments. A fundamental lesson in SNAP education. PSC is an overarching concept that explains the levels at which a site can cause an effective change through a behavioral outcome. Let's start with the environment. This is relative to the physical environment. For instance, at the healthcare setting, a clinic creates a walking path for staff and patients to use as nutrition support. At a food pantry setting, a food pantry creates attractive displays for its produce for nutrition support. At a community setting, a park district places signs along walking paths to encourage other healthy actions as nutrition support. At the systems level, we are referring to systems such as those programs or defined functions that assist in an organization's clientele, such as at the healthcare setting, social workers connect patients to the Find Food Illinois Community Resource Map to help them find local food pantries. At the food pantry setting, a food pantry implements a client choice model. At the community setting, a coalition of food pantries and retailers work together to coordinate mobile markets. A policy can be anything from a procedure to an operations manual. Here we see examples like at the healthcare setting, a clinic implements a healthy vending policy to support the health of patients. At the food pantry setting, a food pantry has a nutrition policy that prioritizes healthy food. At the community setting, a coalition works with the city to proclaim September 15th as Hunger Action Day. On to the next activity. For this activity, I'm going to tell you a quick story because stories are one of the best ways to learn. Sonia is an 18-year-old college student who just started her first semester. She's not used to studying so much or having to set her own sleep schedules. Sonia was never taught to cook at home, so she resorts to eating a lot of snacks and takeout. She notices that eating these foods gives her symptoms like acid reflux or painful stomach cramps. Over time, Sonia notices that her body mass index is increasing, Along with this rising BMI, she's developed high blood pressure, obesity, and is pre-diabetic. She ends up paying not only her tuition, but hospital bills, high insurance premiums, and the cost of medications. So let's talk about how we can help Sonia. What are interventions in the physical environment that could help Sonia?
Sonia could walk or study at a park instead of in her room every day to get some exercise.
Very good. What are interventions at the systems level that could help Sonia?
Maybe the school has a community cooking class that she can join. She could get a free meal and learn how to cook.
Perfect. What are interventions at the policy level that could help Sonia?
The school could implement healthier options in the cafeteria, like a salad bar.
Wonderful. Any other ideas?
Maybe Sonia should take a health class.
Great idea. I completely agree. And we have come to the end of another presentation in our Nourishing Minds webinar series. Here are the references for your liking. I'll leave them up for a little bit. Thank you all for attending. We greatly appreciate it. Again, my name is Bianca Bautista.